Bismillahirrahmanirrahim. Rabbi zidni ilma. Don't be satisfied with stories, how things have gone with others. Unfold your own myth. Assalamu alaikum everyone. My name is Dr. Sadia Rafiq and under the supervision of Professor Dr. Saira Afzal, today my topic of presentation is diabetes mellitus. Learning objectives include the introduction, classification of diabetes, type 1 and type 2 diabetes, metabolic syndrome, epidemiology, screening, management, prevention, recent advances, and at the end, multiple choice questions. Learning outcome. At the end of this presentation, participants would be able to describe their diabetes, types, epidemiology, screening, prevention, and management. According to World Health Organization, the key facts about diabetes are the prevalence of the diabetes is rising rapidly in low and middle income countries than in high income countries. Diabetes is a major cause of blindness, kidney failure, heart attack, stroke, and lower limb amputation. In 2000, between 2000 and 2019, there was a 3% increase in diabetes mortality rate by age. And in 2019, there were estimated 2 million deaths. A healthy diet, regular physical activity, maintaining a normal weight, and avoiding tobacco use are ways to prevent or delay the onset of type 2 diabetes. And diabetes can be treated and its consequences can be avoided with healthy lifestyle. World Diabetes Day is being celebrated on 14th November. Introduction. Diabetes is a chronic metabolic disease characterized by elevated levels of blood glucose or blood sugar, which leads over time to serious damage to the heart, blood vessels, eyes, kidneys, and nerves. Classification of diabetes. Type 1. There's beta cell destruction, usually leading to absolute insulin deficiency. Type 2 diabetes include insulin resistance with insulin secretion deficiency. 90 to 95% of people who have diabetes have type 2. Other specific types are genetic defects, exocrine pancreas diseases, endocrinopathies, drugs or chemical-induced infection, and other rare forms. And fourth one is gestational insulin resistance with beta cell dysfunction during pregnancy. Diabetes mellitus as a part of metabolic syndrome. Type 2 diabetes and cardiovascular share a common antecedent. The concept, the metabolic syndrome, is basically the clustering of central obesity with several other major cardiovascular disease risk factors. So if you see the metabolic syndrome includes the central obesity, heart diseases, lipid problems, hypertension, and type 2 diabetes. Metabolic syndrome, which is called syndrome X. Avoid the X factor leads to diabetes, stroke, and heart diseases. If we see the abdominal obesity, waist is more than 40 inches in man, 135 inches in female, then the hyperglycemia, fasting blood glucose level more than 110, then the hypertension, high BP readings, and the lipid profile, to increase triglycerides level and decrease in good cholesterol. So angels have healthy lifestyle. This is about the syndrome X. Now, what is the basic difference between type 1 and type 2 diabetes? In type 1 diabetes, in pancreas, there's decreased insulin in the blood vessels. So, increased glucose due to low insulin. Muscles are unable to use glucose due to low insulin. And the glycogen and protein breakdown causes ketoacidosis. Whereas in type 2 diabetes, there's pancreas, there's sufficient insulin secreted in the bloodstream, increased glucose in the bloodstream, but muscles are unable to use glucose due to insulin resistance. Obesity, inheritance, and other factors leading to insulin resistance. Causes of type 1 diabetes include the autoimmune disease, viruses and infections, autoimmune restriction of beta cell, damage or removal of the pancreas, unfavorable environmental factors, drugs and chemical toxins, endocrine diseases, hereditary predisposition. Symptoms of type 1 diabetes in adults and children: excessive thirst, excessive hunger, unexplained weight loss, blurred vision, slow healing of cuts and sores, fatigue, vaginal yeast infections, and frequent urination, including frequent full diapers in infants and bedwetting in children. Causes of type 2 diabetes mellitus include the genetic factor, obesity, lack of exercise, diet, ethnicity, age, smoking, lower sleep duration, stress, and high blood pressure. And early signs and symptoms of type 2 diabetes are frequent urination, increased thirst, always feeling hunger, feeling very tired, blurry vision, infections, tingling numbness in the hands or feet, weight gain or loss without trying, and slow healing of cuts and wounds. If we compare type 1 and type 2 diabetes, type 1 cannot be prevented or cured. The body does not create enough insulin. Causes are unknown, but genetics may play a role, require insulin injections for life. Whereas in type 2 can be prevented through lifestyle modification, the body does not create enough insulin or develop insulin resistance. Causes include genetics, aging, inactivity, obesity, or more, requires insulin as needed injection or oral. And the factors which are present in both things can cause serious health problems and complications. It requires a healthy lifestyle and medical supervision, and symptoms include thirst, frequent urination, and blurry vision. Gestational diabetes symptoms and management. Gestational diabetes symptoms are constant thirst, constant hunger, constant urge to urinate. And the managing gestational diabetes, consult with your gynecologist, healthy low sugar diet, staying active or exercising, and losing extra weight. And the effects of the gestational diabetes could be preeclampsia in the mother, then cesarean delivery, and the macrosomia. Talking about the epidemiology. Insulin-dependent diabetes mellitus and non-insulin dependent diabetes mellitus. The host would be age less than 30 in insulin dependence and more than 30 in non-insulin dependence. Then both sexes are involved, the type A1 HLA, tier 3, tier 4, then gestational diabetes mellitus and obesity, and the environment includes a sedentary lifestyle, low dietary fibers, malnutrition, alcohol, stress, viral infections, beta cell destruction. If we compare the type 1 and type 2 diabetes, the onset is sudden, in type 2 it's gradual. Age of onset is usually young and it is mostly in adults. Body habitus is usually thin or normal and they are often obese. Ketoacidosis is common in type 1 but it is rare in type 2. Antibodies usually present, here they are absent. Endogenous insulin is low or absent, but in type 2 it's normal, decreased or increased. Concordance in identical twins is 50% and it is in 90%. Prevalence is less prevalent type 1 and more prevalent, 90 to 95% is type 2 diabetes. Talking about the major complication of diabetes are the microvascular and macrovascular. In microvascular, if talking about eyes, high blood pressure, glucose, and high blood pressure can damage eye blood vessels, causing retinopathy, cataract, and glaucoma. Like they can affect kidney and cornea nephropathy, and in nerves, it causes neuropathy. And also brain, increased risk of stroke, cardiovascular diseases, transient ischemic attacks, cognitive impairments. In the heart, it can cause myocardial infarction, and in extremis, peripheral vascular diseases by narrowing of blood vessels. And it leads to different complications. Screening. Urine examination. Urine test for glucose 2 hours after meal. All those with glycosuria considered diabetic unless proven by standard oral glucose tolerance test. Glycosuria is present in most severe cases of diabetes mostly. Sensitivity of test varies 10 to 50%. Test results in missed diabetics. Results in false negative if it is only diagnostic test. Not considered an appropriate tool for case finding. Blood sugar testing. Standard oral glucose test cornerstone of diabetes diagnosis. Screening program mostly use fasting, postprandial, or random blood sample. In epidemiology survey, the random blood glucose level is considered unsatisfactory. Recommendation for epidemiological surveys 2-hour value after 75 grams oral glucose alone or with fasting value. Diagnosis of prediabetes and diabetes. Test is how performed. Fasting plasma glucose is measured after at least 8 hours fast. Oral glucose tolerance test. 75 grams glucose low drink is ingested and after at least an 8 hours fast, blood glucose is measured at 2 hours. And the random plasma glucose with symptoms, blood glucose is measured at any time regardless of eating. So the normal fasting would be less than 110 milligram per deciliter and OGTT would be less than 140 milligram per deciliter, which is 7.8 millimoles per liter. So if we see pre-diabetes, it's impaired fasting glucose test and it is impaired glucose tolerance test. So the fasting at between 110 to 125 milligram and OGGT 140 to 199 milligram per deciliter. So in case of, these are the values of impaired one. In case of diabetes mellitus, it would be more than 126 milligram per deciliter and OGTT would be more than 200 milligram per deciliter. And the random would be more than 200 in case of diabetes mellitus. So hemoglobin A1C, percentage of which glucose is attached. Normal is less than 0.57%. And in case of pre-diabetics, its value would be between 5.7 to 6.4%. And in diabetics, it would be more than 6.5%. Investigations during follow-up required the urine sugar to us postprandial once in a week, blood sugar, FBS, and PPBS once in 3 to 6 months, lipid profile once in a year, ECG once in a year, urine albumin, blood urea, serum creatinine for the kidney profile, retinopathy once in a year, glycated hemoglobin once in 3 to 6 months. According to CDC, the road to type 2 diabetes. If these are the value of hemoglobin A1C test, it is the fasting and it is the glucose tolerance test. For in case of normal, hemoglobin A1C should be below 5.7. Fasting level should be below 99 or 99 and good glucose tolerance test would be 140 or below. So if it is value is increased 5.7 to 6 pre-diabetics and it is more than 6 then it is diabetic. So these are the values now we follow according to CDC. Type 2 diabetes is a rising threat in youth. Pre-diabetes is a risk factor for developing type 2 diabetes. Who has pre-diabetes? 1 in 5 aged 12 to 18 years, 1 in 4 aged 19 to 34 years, and pre-diabetes is higher in males and people with obesity. So parents should talk to the child healthcare provider about testing for type 2 diabetes. And there should be a healthy lifestyle modification. Target population for diabetes screening includes age group 40 years and above, family history of diabetes, obesity, women with body weight more than 4.5 kg, women with excessive weight during pregnancy, and patients with premature atherosclerosis. Management of diabetes mellitus is by diet, lifestyle modification, oral hypoglycemic agents, and insulin. Lifestyle changes that help control diabetes includes plan your meals, exercise 30 minutes, 5 days a week, get 7 to 9 hours of sleep, eat a healthy diet, take your medication as prescribed, quit smoking, manage blood pressure and cholesterol, watch your stress level, limit alcohol, keep your medical appointments. So lifestyle modification includes a regular exercise, walking, other aerobic exercises, maintenance of weight, stop smoking and foot care. And then if satisfactory control is not possible with diet and lifestyle changes alone, then oral anti-diabetic drugs, which includes sulfonyl, ureas, bigonides, etc. And after that, the third option is insulin. There are different types of insulin, short-acting and long-acting. I'm not going into details of it. So talking about prevention and care. Levels of prevention in type 2 diabetes. Primary includes activities aimed at preventing diabetes from occurring in susceptible population. Secondary, early diagnosis and effective control of diabetes in order to delay the progress of the disease. And tertiary, prevent complications and disabilities due to diabetes. Primary prevention. Scope for primary prevention of type 1 diabetes is limited. As we know, its etiology. The population strategy is primordial prevention, which is the prevention of emergence of risk factors. Maintain body weight through adoption of healthy nutritional habits and physical exercise. High-risk strategies, sedentary lifestyle is obesity, avoid alcohol, smoking, high blood pressure, elevated cholesterol, and triglycerides level. Secondary prevention includes early diagnosis and treatment, maintain blood glucose level, maintain ideal weight, blood pressure measurement, routine blood glucose monitoring, urine for ketones and proteins, glycosylated hemoglobin estimation, 6 months and should be less than 6%. Diabetes routine self-care practices include the blood glucose monitor, balanced nutritional food, carbohydrate counting, medication, yoga, and exercise. So diet and regular exercise, keep an eye on blood sugar levels. One should be particular about medications and good oral hygiene and to lose weight. Tertiary prevention approaches. Strict metabolic control, education, and effective treatment. Screening for complications in their early stages when intervention is more effective. Talking about the screening of eye problems. Screening for diabetic retinopathy is cost-effective where subsequent treatment such as laser treatment is available and affordable. Where there is no access to laser treatment, good metabolic control aimed at delaying the progress of diabetic eye disease is likely to be cost-effective. Managing foot problems. A number of interventions have been made to be effective in preventing foot problems like education, pressure relieving interventions, and multidisciplinary clinics. The foot care guide is also available, which is 9-step daily foot care guide for the people with diabetes, including a wash your feet, dry your feet, apply creams your toes, massage them, check your feet for any cuts, cut your nails, wear clean socks, have comfortable shoes, then never walk barefoot, and examine your shoes for things that might hurt your feet. And not talking about the renal problems. Renal failure and diabetes can be detected very early by screening for microalbuminuria. However, effective treatment must be available in order to follow on from the detection of this early sign of renal failure. Classic levers in the public health response to diabetes. Clinical services include the glycemic control, BP control, lipid management, annual eye examination, foot care, kidney disease testing, flu immunization, preconception care, diabetes education, case management, and targeted screening. Promotion of behaviors, education and awareness for physical activity, reduced tobacco, healthy diet, regular doctor visits, self-monitoring, and self-education. Population targeted policies are healthcare access legislation, drug and supply reimbursement policies, population registry, and feedback systems. This is the whole diabetes health infographics, including from the symptoms and the complications and the preventions and treatment. Moving towards the recent advances. According to International Diabetes Federation, with 1 in 4 adults living with diabetes, Pakistan has highest diabetes prevalence in the world. New figure from the International Diabetes Federation show that 33 million adults in the country are affected by the condition. Only China with 140 million and India 74 million have high number of people living with diabetes. So diabetes is responsible for 4 lakh deaths in Pakistan in 2021. So the prevalence of diabetes is increasing. Like in 2021, 33 million adults in Pakistan are living with diabetes, where there was a 70% increase since 2019. This was an article, The Increasing Rate of Diabetes in Pakistan, a Silent Killer. According to International Diabetes Federation in 2022, 26.7% of adults in Pakistan are affected by diabetes, making the total number of cases approximately 33 billion. The number is alarming high, so increasing with each year. You can see this. It was in 2016, 18, 19, and in 2022. 3 organizations addressing diabetes in Pakistan. In 2019, Pakistan ranked 6th globally for the prevalence of diabetes. And the organization are Diabetics Institute of Pakistan, which is called DIP. It was founded in 1996. It has become the leading organization for diabetes management, treatment, education, and counseling in the country. Second is World Diabetes Foundation Project. It was make treatment more widely accessible, especially focused on helping low-income individuals and areas. And between 2015 and 18, WDF trained more than 300 nurses, doctors, and paramedics in proper prevention, diagnosis, and treatment to serve better the needs of the communities. And the Diabetes Center is a non-profit organization in Islamabad. It aims to improve access to diagnostic screening and treatment for diabetes in Pakistan by providing these services for low-income countries. The organization has 12 clinics that respond to specific complications of disease, such as kidney, cardiac, and eye care facilities. According to WHO, WHO aims to stimulate and support the adoption of effective measures. So it provides scientific guidelines for prevention and major non-communicable disease, including diabetes, develops norms and standards for diabetes diagnosis and care. And Diabetes Day is on 14 December. The WHO Global Report on Diabetes provide an overview of diabetes burden, intervention available to prevent diabetes. And the WHO module on diagnosis and management of type 2 diabetes bring together guidance on diagnosis, classification, and management of type 2 diabetes in one document. In April 2021, WHO launched the Global Diabetes Compact, a global initiative aiming for sustained improvement in diabetes prevention and care, with a particular focus on supporting low and middle income countries. It is one of the assess of knowledge, attitude, and practice of Pakistani population about the risk factor, causes, complication, management of diabetes mellitus. A cross-section studies was conducted in Government College University, Faisalabad from December 2017 to 18. The subjects were from different cities of Punjab, where data was collected regarding socio-demographic characteristics, general knowledge about diabetes, perception regarding indication, risk factor, diagnosis. The results were over 2,000 subjects. 48.6 had family history of diabetes. 66% were living in urban area, and 40% were employed and belong to socioeconomic balanced families. So the composite knowledge score was significantly associated with age and socioeconomic status. A high significant association was observed regarding family history and level of education and occupation with composite knowledge score. So the knowledge level about diabetes was seen to be average. Diabetes in Pakistan, a systematic review and meta-analysis. The purpose of this study was to assess the time trend of the prevalence of diabetes and pre-diabetes and diabetes and risk factors associated in diabetes in Pakistan. And the conclusion was has been a continuous increase in the prevalence of pre-diabetes and diabetes in Pakistan. All over the country is affected, with the highest in Sindh and lower in Khyber Pakhtunkhwa. COVID-19 and diabetes, understanding the interrelationship and risk for the severe course. The relationship between COVID-19 and diabetes mellitus is complicated and bidirectional. On the one hand, diabetes mellitus is considered one of the most important risk factors for a severe course of COVID-19. Several factors that are often present in diabetes mellitus are also likely to contribute to the risk factors such as old age, pro-inflammatory, and hypercoagulable state. So, severe COVID-19 infection and its treatment with steroids can have a specific negative impact on diabetes itself. Now it's time for the multiple choice questions. Question number 1. A 19 years old female presented in the outpatient department with the symptom of extreme thirst, increased hunger, especially after eating, dry mouth, frequent urination, and unexplained weight loss from the last 2 months. She reported a prior history of diabetes diagnosis 1 year ago, managed with diet control. She reports fasting glucose is 150 to 230 milligram per dl, range most days. She checked her blood glucose before breakfast occasionally and reported glucose usually over 200. Most likely, cause of these symptoms are due to gestational diabetes, malnutrition-induced diabetes, steroid-induced diabetes, type 1 diabetes, or type 2 diabetes.
D. Type 1 diabetes.
Yes, the correct answer is type 1 diabetes. Question number 2. Mr. Akbar is a 58 years old gentleman with a family history of diabetes. He has a background of ischemic heart disease, mixed hyperlipidemia, and hypertension. He had a delayed presentation of an inferior myocardial infarction 3 months ago. His most recent lab shows fasting glucose 120 milligrams per dl, hemoglobin A1C 6. He has the type of diabetes, gestational diabetes, pre-diabetes, steroid-induced diabetes, type 1 diabetes, or type 2 diabetes.
E.
No, the correct answer is pre-diabetes. If you see, his blood glucose is 120 and hemoglobin 6 is 6. So the pre-diabetics, it starts from 5.8 to 6.4. So it is, the correct answer is B, pre-diabetes. A 45 years old male presented in the outpatient department with symptoms of tingling and numbness in feet, leg cramps, weight gain, extreme thirst, increased hunger, especially after eating, dry mouth, frequent urination from the last 2 years. He reported a positive family history of diabetes. He recently showed a post of fasting glucose is 230 milligram per dl, range most days, and hemoglobin A1C 8. A most likely cause of these symptoms is due to gestational diabetes, pre-diabetes, steroid-induced type 1 or type 2 diabetes.
E.
Yes, the correct answer is E, type 2 diabetes. A 55 years male presented in the medical outpatient department with the symptoms increased thirst and urination, fatigue, and blood gain for the last 6 months. On clinical physical examination, BP is 140 by 85 millimeter of mercury, BMI 36 kilogram per meter square, waistline of 40 inches. His clinical lab assessment, triglyceride 160 milligram per dl, fasting blood glucose level 155, and high density lipoprotein level less than 30. The most likely cause of this sign and symptoms is Addison's disease, Cushing syndrome, metabolic syndrome, Paget's disease, or thyroid disease.
C. Metabolic.
Yes, C is the correct answer, metabolic syndrome. A 25 years, 28 weeks pregnant female presented in gynecology and obstetrician outpatient department with the symptoms of increased thirst, fatigue, and increased urination for the last 1 month. She gave a positive family history of diabetes. The most likely cause of these symptoms are due to gestational diabetes, pre-diabetes, steroid-induced type 1 or type 2 diabetes.
A.
Yes, the correct answer is gestational diabetes. A 64 years old female present to the diabetic clinic to manage type 2 diabetes mellitus diagnosed 15 years ago. She was recently diagnosed with diabetic gastroparesis. The long-term complication of diabetes mellitus in her case could be fungal infection of the nose, fungal infection of the throat, urinary tract infection, skin and soft tissue infection, or visual impairment.
C.
No, the correct answer is 65. Look at his age, 64 years of age, and diabetic from last 15 years. So the visual impairment, retinopathy could be there, or cataract, something like that. A group of public health students perform evaluation research on the performance of two commonly used diabetes screening tests among 1057 participants older than 40 years of age. According to research, the sensitivity of one test was 40% and other was 80%. What type of screening test showed low sensitivity in this research? Blood urea, fasting blood glucose level, glycosylated hemoglobin, lipid profile, or urine examination?
C.
No.
E.
Yes, urine examination, it has low sensitivity, 40%. A 58 years old male has type 2 diabetes mellitus for the last 5 years. His glycosylated hemoglobin is 7.5% while oral anti-diabetic drugs daily. He is otherwise well and there's increase in his body weight. He gave a history of smoking and sedentary life. Which of the following would be the next best treatment options? Change oral anti-diabetic drugs, increase the calories from carbohydrate to 70%, increase the calorie of fat for 50%, increase the calorie for protein up to 30%, or regular exercise and stop smoking.
E.
Yes, the correct answer is E. Mr. Ali wants to conduct a population-based study to determine the prevalence of diabetes mellitus type 2 in the ABC population. Which screening test is recommended as best for epidemiological survey? Blood urea glycosylated hemoglobin lipoprofile 2 hours value for 75 grams oral glucose or urine examination.
D. D.
Yes, D is the correct answer. 75 grams glucose. Mr. Ali, a 50 years old male, he has had diabetes mellitus for the past 10 years. His glycosylated hemoglobin is 8 and he is on a oral diabetic medication. On his recent routine checkup in the endocrinology clinic, the physician advised him to exercise, maintain his weight, foot care, and regularly walk. Which of the following type of diabetes in which primary prevention has limited scope? Gestational diabetes, malnutrition-induced diabetes, steroid-induced diabetes, type 1 diabetes, or type 2 diabetes?
E. D. Type 1 diabetes.
Yes, type 1 diabetes. This is the key. These are the references. This is a YouTube link, and thank you so much.
Thank you very much, Dr. Sadia. Wonderful time management. It is beautifully presented slides. You have a very good presentation skills, communication skills, as well as time management skills. And we have witnessed how you have beautifully presented 72 slides in such a short time. As far as the presentation content is concerned, it was beautifully arranged. It was very well organized, and you have talked about very important things. However, there are few important things that I must highlight here. One is about the malnutrition-induced diabetes. It has been documented, and now we have a lot of research that is available, that babies who have low birth weight, later on they suffered from diabetes. And it is the diabetes 2 that has the strongest association with malnutrition. Second important thing, as you have also asked in one of your MCQ, that was MCQ number 1 about the type of diabetes, type 1 and type 2 in 19 years old. And I have seen that most of the students, they have correctly identified that it is type 1. However, few students, yes, they also have picked the answer type 2 diabetes. And both are right. Actually, both are right, because we have seen in countries, especially in developing countries like Pakistan, that there is a diabetes that is called maturity onset diabetes that have the features of both type 1 and type 2. And there is another type of diabetes that is called latent autoimmune diabetes in adults. And again, that has the symptoms of both type 1 and type 2, but also have their own symptoms, and their treatment is slightly different. In maturity onset diabetes, the people are more affected who have one of the parent that has diabetes, and they produce insulin just like type 2, but their insulin levels are very low. So their age is young. That is why it is called maturity onset diabetes of the young, because their age is 19 years or 20 years. However, the important thing is we have to measure their insulin levels. And that is why we always look for the home IR index. That is very important, that how much insulin is present and how much resistance to insulin is present. And most important thing is that the insulin that is being produced, it is not being utilized. And for many years, they have not been diagnosed as diabetes because people have no idea about MODI and LADA in most of these settings. So this can be type 2 diabetes as well. So those who have picked the option of type 2, once again, I would say that they have picked the correct option, and it is nothing wrong with them, because the whole of the scenario is not leading us whether it is MODI or it is type 1. So maturity onset diabetes of the young, it is prevalent in Pakistan, and we are looking many patients who are younger than 35 years. Similarly, when Dr. Sadia was presenting about the risk factors, one of the risk factor was age. Again, there is a lot of debate about the age, because the latest and recent advances have shown us that age is much younger as previously been described. So it is not the age that is above 30 years or 35 years. It is even in early 20s, and even 19 years is the age where even type 2 diabetes or maturity onset diabetes of the young or LADA, they have been documented. So these are my few cents in this discussion. Very well done, Dr. Sadia,
Thank you
and
so
Allah
much.
Hafiz.
Allah Hafiz. Thank you, ma'am. Allah Hafiz.
Allah Hafiz.